Good morning, I'm Adam Sexton. As we all adjust to a new framework for our lives, there are tireless efforts underway by state employees to do everything possible to respond to the ongoing COVID-19 pandemic crisis. Joining us this morning to discuss is Perry Plummer, the Assistant Commissioner of Safety in New Hampshire. Thanks for joining us, Assistant Commissioner. And we are practicing social distancing here, so that is why we have the greater than normal space between us here. So the last time we spoke, you were saying that the structure of this emergency is not abnormal. It's the scope and the duration. Explain what's different about this response.
Yeah, you know, over the last 7 or 8 years, we've put structures in place. So if we're planning for one disaster, we're planning for all disasters, whether it be a cyber disaster, whether it be flooding, whether it be a public health disaster. That structure's in place. The command structure, the emergency operations structure, how all the information flows and gets vetted and pushed back out, how decisions are made. All that structure's in place. Now, obviously, we're in unprecedented times with a unusual type of emergency. So the questions that are coming in and the things that we're dealing with are totally unique. But the structure around making those decisions, getting that information, vetting that information, and pushing that information back out has been there. And therefore, we're more coordinated than we normally would be if obviously that structure wasn't in place.
Describe what's going on at the EOC right now. And having been there myself over the last decade or so reporting, you know, usually you'll see the operations center and things like that. I don't think I've seen that parking lot so full and so many different rooms employed in different aspects of dealing with a crisis.
Yeah, typically we have our emergency operations center and then we have all the business process that's happening around it. We've basically taken over the whole building. Every office is got someone doing some type of planning, some type of response work in it. But so we probably have 150 people at that building working right now, trying to separate them as much as possible, do the planning, and try to make these decisions on a timely basis to get the governor and the leadership team the information that they need to make these very difficult and critical decisions.
For instance, on the big board up there, you're tracking the global pandemic. You know, down the hall, there's a room dealing with schools. Explain what's going on, say, in a room like that.
Yeah, absolutely. So we're looking at what's happening, you know, obviously internationally. We're looking at what's happening across the country, what's happening in our region, and what's happening in the state, and trying to learn from all those decisions that are being made as we make our decisions. So, you know, Department of Education had an office in our building, so they're dealing with all the education pieces, you know, and then they reach back to their leadership team, but there's a person there that's touching all the decisions. So one decision obviously affects the next decision, affects this decision, that decision. So we're trying to get all those people there to make sure it's a harmonized, you know, response, and making sure that they have all the information they can have to make timely decisions. So we have all those breakout rooms. We have representatives in the EOC from every sector. So everything is trying to be thought of so as we kind of make these decisions.
Right. It's a staggering amount of work being done across just about every sector of government in New Hampshire. One of the things that you usually deal with in disaster or emergency response, you can call on Canada for massive power outages. You can call on another state to bring those resources. That's really not on the table this time around, right? Because this is everywhere else?
Exactly. You know, most of our disasters are very localized. Even within our state, they're like a little region of the state of flooding or something like that, and then you get the whole state disaster, and then sometimes you get a New England disaster, but we can pull resources from the rest of the country. In this case, it's countrywide. It's actually worldwide, and that's some of our challenges, because our normal avenues to get supplies, to get information, to get workers, those aren't available to us. So we have to repurpose that, just-in-time training, look within our own system a little bit more. Now, we've planned for some of these. Just even 8 months ago, we had all the leaders in the state dealing with a cyber exercise that shut down all in New England, you know, on a tabletop level. We had, you know, 100 of our top leaders work through that for a day to make sure what would happen there. We're taking all those types of exercises and bringing that experience into this response. We have plans. We have a commodities plan to distribute commodities should that need be. We, you know, Health and Human Services, and let me just say that staff at Health and Human Services, Laurie Sherbinet and her team is doing a fantastic job to try to just manage this and get all the information in an unprecedented times. With that, they have surge plans. We have plans for almost every situation. This one is just a little bit different. So we're bringing those plans together and trying to apply them to this emergency.
We talked about all the rooms there at the EOC. One of them is for HHS. Describe the efforts you have going right now to obtain more of this personal protective equipment, or PPE, for the frontline first responders and those medical workers in the ERs, and for the respiratory equipment they're going to need as well.
Yeah, so, you know, we have logistics people that just try to get stuff. And so, you know, obviously our first anything locally, try to get it locally, try to buy it, try to obtain it, do whatever we can do. And then we rely on the federal government for like a national stockpile, a strategic stockpile to get those things. With that being said, most of the country's disasters have been regional, so they can send that national stockpile somewhere. This is across the country. So we're gearing up, trying to get it, that personal protective equipment for healthcare workers, for first response, fire, EMS, police, to try to protect them. Because what's happening out there is they're exposed. So a fire department goes on an EMS call and they get exposed. That's 6 people out of a fire department of maybe 20 people that are out of service for 14 days. We're trying to protect that. We have to get them the protection they need so they can stay on the job. With that being said, the best thing that the public can help us do is adhere to the recommendations. Social distance, stay at home. And I know that, you know, there's a high-risk population, obviously. They're doing pretty well. They're putting in plans for their own safety. You know, they're getting food dropped off. They're doing a really good job. It's the healthy, younger generation that are saying, it's really not affecting me, so I don't have to adhere to some of those. What's happening is they're going to spread the disease, and they can spread it to more vulnerable populations. They can spread it to each other, even though they're feeling healthy. We're asking them, please, only do the things you need to do. Adhere to those great recommendations, which means only go in crowded places when you need to. You know, continue to wash your hands. Continue to practice social distance. The only way we're going to get through this is together. We're all working hard to try to affect that curve. We've already seen the curve in China starting to curve. We've seen South Korea's curve really curve. So we're trying to get to that point where this is leveling off and curving, and we just got to get there.
A life or death situation, certainly, but for a lot of people right now, they go to their grocery store and they see, you know, the toilet paper still might not be fully restocked on the shelves. Certain items are out. What do those supply chains look like right now, and what's the message to the public in terms of sort of the outlook there over the next week or two?
That's an excellent question. I talked to John Dumas from the Grocers Association as recently as late last night, having those conversations. We're ready to help that supply chain. They're in good shape right now. It's being stressed. This system is being stressed. Let me just say that. With that being said, they're good. They said the commodities are coming in. They're getting their shelves restocked. They are able to manage. With that being said, we stand ready. The governor's made sure that we stand ready with National Guard or state assets to help that supply chain stay strong. But right now, the system is stressed. Patience and good common sense will get us through some of this, but we are ready to stand. Should this get worse, should there be a bump in the system, we stand ready to offer that supply, and we are in communication with them on a regular basis to ensure that everybody's ready to deal with this in any way that we have to.
You're a former fire chief and the former director of Homeland Security and Emergency Management here. Are you concerned at all about capacity for first responders? As you see places like Salem having to put those firefighters aside, you know, life goes on, not the same, but certainly the weather's not going to change. We know April and May can be bad for flooding in New Hampshire on occasion. Is there any concern about the capacity for our first responders to handle something on top of this?
We're very concerned about it. With that being said, we're also talking about it every single day and coming up with solutions. Some solutions are in our plans and we plan for it, and some are out of the box thinking. You know, we've waived some emergency rules where our law required 2 licensed emergency medical providers on every ambulance. Well, we waived that rule and said you can put 1 licensed medical provider in the back and have a non-medical driver. So we're looking at how do we stretch our resources more? But we're very concerned with healthcare workers and first response. The best way to keep them on the front lines is not get them exposed, and so practicing those, what I talked about, those social distancing and those recommendations will curb the spread. Therefore, it helps us spread our resources out. With that being said, we are asking that if you know you've been exposed to COVID-19, 911 is asking those questions when they come. It's not a matter of they won't come. It's a matter of that they put certain PPE on, protective, when they go there. If they do it on every call, they won't have enough to get by. So we're asking for the public's help in that area. We are all in this together. With that being said, we are talking about how do we spread resources from, Berlin to Salem and get those resources, both police, fire, EMS, and healthcare workers. With that being said, if we have a big utility, we've been talking to utility companies. A lot of our assets come from Canada. The border's closed. What's that look like? How would we bring them over the border if the border's closed? And how do we protect all of our citizens when we do those things? So those things are all being talked about. We're working 24/7 in planning cells, thinking of everything we possibly can, and we're working hard to try to manage this as best we can.
As you look out 2 to 3 weeks, should Granite Staters be prepared for hospitals to be extraordinarily busy? We'll see tents and potentially other remote locations set up in terms of armories, school gyms maybe for triage?
Yep, absolutely. We're working on all that. With that being said, that's why the main thing our public can do is stay informed, because things are changing rapidly, some for the worse, some for the better. But some of our recommendations are going to change because of either capacity or what we're learning from other countries and the rest of our country. So, for example, we were saying, look, you need a test. We're testing everybody. We don't have the capacity to do that. Over 80% of the people that get this are not going to require medical treatment per se. So some populations will say, you're going to get it. Your testing won't matter. You get it. You isolate for 14 days, and then 72 hours after you don't have any symptoms, you go back to your life. So those recommendations are going to change. We're trying to keep the medical system for the true medical emergencies and the people that are most affected. So you're going to see how do we manage that. Some of our recommendations will change for that. But we're working on surge capacity. How do we stand up mobile hospitals? Do that. How do we separate people that have had exposures from people that don't have exposures? We're looking at Commissioner Shibboleth and her team are looking at telemedicine. How do you do that from a computer screen and therefore give the people medical care that they need without infecting anybody else? So all of those things are looked at, but people really should prepare. Hope for the best, prepare for the worst, stay reasonable, and keep informed.
And as we wrap up here, you talked about what people can do. What about you guys? At the top there, we know you can work for 72 hours straight, maybe a week, but 7 weeks, this is different. So you guys are going to have to change the way you operate as well as we go through this.
There's no question. Most of our disasters are 48 hours, 72 hours. I can be in an operations center for, 30 hours without sleep and then grab some sleep in 30 more hours. So we're looking at our staffing plans. Keep in mind, we're changing how state governments run right now. We're waiving a lot of things. We're going to have workers that aren't doing their normal business, and we're bringing them in, giving them just-in-time training to supplement all of us so we can make sure that our staffing levels are such that planning continues no matter who's sitting in the seat, and therefore there's not a drop-off because we're starting to get tired. And quite frankly, good decisions continue to be made. I can tell you that we're working long hours on this. We're going to continue to work long hours and make the decisions that are best for our state, for sure.
All right, Assistant Commissioner Plummer, thank you for your efforts and best of luck in this ongoing situation.